Okay, so we've got a patch from EMS. We're getting a 33-year-old male who was in an ATV rollover, who has reported low blood pressure and some trauma to his right side of his chest. Do we want to get the room set up and see who's going to do what jobs?
Sure.
Sounds good.
Okay.
Should we get the pelvic binder on the bed?
Yeah, why don't we put the pelvic binder on the bed to start?
Do you know if he has IVs or anything?
I don't know that. Hopefully EMS will tell us when they get here.
Austin, I'll get ready to put in another line.
Okay, perfect.
Who's going to do what then?
Jess, do you want to get the patient on the monitor? Should we get some blood ordered in the meantime?
Sure, why don't we just for everyone's mechanism, why don't we get 2 units of
Okay.
O positive?
All right,
Do you
I'll go
wanna
call
order
for that.
Okay, great.
The CTA.
They should be here anytime, I think.
Blood's ordered. It should be up here in a minute.
Okay. I don't know whether there's any other nurses that are available, if we can see if anyone else
Yeah,
is.
we'll call.
Yeah, if we can.
Okay, this
Oh,
is
hey.
Brett.
Okay.
There's some gloves here.
Yeah, thanks.
We haven't been able to do a whole bunch. I did get a 18 gauge in Gregg AC though.
Okay.
Okay.
Do you want to move them over or put them on your monitor first?
Do you want to film on the monitor?
Yeah, let's get them on our stretcher.
Why don't we get it? Yeah, let's get him moved over. So, do you have any more of his story there?
Just he's 33-year-old man. He was just in an ATV
Wanna go on that
accident.
side?
He was complaining mostly of pain on his right side.
He's collared. Is he boarded?
He's
No.
not boarded.
Okay. So just maybe we grab his green there, just to make sure we take them all there. Okay. EMS on your count.
Okay. Ready? 1, 2, 3. Oh, sorry, Rod.
So you have one IV in?
Yes, just one on the right side.
Okay, so we can get him hooked up to monitors there as well. We'll get him hooked up to our monitors. So, and what's his last, did he have any of your last vitals there?
Sorry, they were just on the
Oh, okay.
monitor there. So heart rate was 113. That's of 89.
Okay.
Blood pressure was 92/56.
Okay, so he's got a heart rate of 115 and a systolic blood pressure of 90. Okay. Okay. I'm concerned that he's got a shock index of greater than 1, so if we can get that 2 units to start, and then we'll see afterwards about whether we need more.
I think the buttons just came off. That's
Do we
good.
know Allison, was the blood going to come up?
It should come up with lab.
Okay. Okay. So let's get him hooked up to monitors. I'm going to just do
Do
a
you want
primary
the-
survey here.
Do you want the blood under pressure
I
or
think
just
that'd
with the tachycardia and everything
Yeah, I think
else?
that'd be great if you can get a unit under pressure. Rhett, are you there?
Still just have the one IV, but I'll put the other one in now.
Okay.
It's all
Rhett, are you,
hooked up.
it's Dr. Bolton. You're at the hospital in Collingwood. Are you having any pain right now?
Yeah.
Doing a blood pressure
My
plate on your
belly.
arm.
Pain in your belly? Okay, you've got some bruising here to your chest and your belly.
Yeah.
So just from a C standpoint, he's tachycardic, and I'm concerned that he has some trauma to his abdomen
Plate
here.
on your arm here, right?
Blood work?
Yeah, please. If we can do some trauma labs and make sure that we get a type and screen for him.
Okay.
Do we have a point of care?
Plate on your arm there,
Make sure we get a
Rhett.
point of care glucose there as well.
Okay.
Brett, I'm just gonna press on your pelvis here, okay? See if you're uncomfortable.
Big poke. Sorry.
Okay. All right. I'm concerned that with that pelvic, with his bruising that he has here, as well as that discomfort, that we should probably just go ahead and put the pelvic binder on him, given his low blood pressure and his systolic that's low. So when you're finished there, Jess, if you can give me a hand and we'll tighten up his pelvic binder.
Yeah.
If we can call X-ray to come for some images of a chest and a pelvis, that would be great. Allison, if you could do that.
Yeah.
I'm just gonna take a listen to his breathing here while you keep going.
Okay, so we have another 18 gauge now in the lefty. So now we have 2.
Jesse from the lab, I've got 2 units of uncrushed blood for you.
Thank you so much. Thank you so much. Oh, yeah, do you want to do it here?
Okay.
Those are pretty wet.
Right.
so we'll-
Why don't we get those off?
Yeah.
Just before we get him undressed here, I'd like to put the pelvic binder on
Okay.
first.
Okay.
Okay.
So we can just slide that down a little
Patient
bit, Jess.
name.
So we have a John Doe.
Yep.
Okay, just make sure it's over his GT on that side. Great.
I have my moon number there.
Just
Want to
fold that
hear,
one
I have
over
a
the
O
other way.
negative. Want to do the unit check here? So I'm going to call it the unit C055620513977.
tight already here.
Expiration date December 30th, and we have red cells.
Great, that's better.
That's it. Perfect. And that's an O negative.
Brad, I'm just gonna get your clothes off.
Check the second
here.
one.
Cover you up.
Sure. So again, we have John Doe
Jess,
O
if you
negative.
can get a
Expiration
temperature,
here
that
is
would
the
be
30th
great.
December 2024. C055620513977.
Fluid or a probe on your chest here, Rhett. Okay, I've got a normal lung slide on his left. He certainly has an abnormal lung slide on his right hand side. I'm concerned that he's got a pneumothorax there at least. Rhett, are you sore there? I'm going to do his fast here. Okay, he has blood in his belly. He's got a positive fast. Okay, I'm just concerned that based upon this gentleman's mechanism as well as his positive shock index, his clinical pelvic fracture as well as the positive fast, I think we should activate the MHP. Who can do that for me?
I'll give that a
Okay,
call.
great, thank you.
Massive hemorrhage protocol, trauma 2. Massive hemorrhage protocol,
His
trauma
temp
2.
is 35.5. Do you want me
Okay.
to grab the bear hugger?
Yeah, that would be great. Okay, so we've got his portable chest here.
Giving you some oxygen there, Rhett.
Okay, great. So I see on his right-hand side that he's got what looks like a hemo-pneumo on his right-hand side. So I'm concerned that when we have the time and once we get this set up, that we're going to have to put in a chest tube. So if we can get that, equipment to the bedside, that would be great. Great. Yeah, you can. This is a gentleman who had a multi-system trauma, who I'm concerned has hemo-pneumo as well as a positive fast. Can you get set up and do a chest tube on this right-hand side? I'm concerned again that this, as we initiate the MHP, that this gentleman can't stay in our hospital. I'm going to call, I'm going to just speak to the clerk and see if they can reach out to critical to trauma to initiate transfer for this gentleman. I'm just going to cycle this blood pressure here, Serena, before you start.
If we're going to be putting the chest tube on here, Jess, do you mind just hooking up the rapid infuser to the other side?
Okay. So again, from an airway standpoint, I don't have any concerns. He's talking. I don't appreciate that he has any facial trauma there on first inspection. I'm concerned that we need to put the chest tube in on the right-hand side, given that X-ray and his findings. We also have bound his pelvis, and we're going to start the massive hemorrhage protocol, given the fact that he's got his shock index that's greater than 1. And then the TXA as well is going to get started. And I know you guys are busy doing those things. Just let me know when that TXA is in. Are you happy there, Allison, with that?
Yeah, I am. I think it's
Okay.
infusing well.
Okay.
No, I've got a unit under pressure that's just finishing up on the pressure bag, 100%. And
Rhett,
then I've got the
are you
second
still with
unit
us?
of blood on the level 1. And
Rhett,
the
are you still
documents
there?
are-
I know that you're uncomfortable. Okay, we're gonna try and put a chest tube in on your right-hand side because your lung isn't working well. Okay? Gonna feel a little discomfort as we do that.
Oh,
Okay, do you have any medical problems that you know of?
No.
Okay, do you take any medications?
No.
Do you have any allergies to medication that you know of?
Are you doing anything right now? I'm not going to help you.
You have an allergy to
Can you
penicillin?
unpack a few
Okay.
things for me as I go?
All right.
Sure.
Okay, did you eat breakfast this morning?
Wash is there.
Yeah.
Oh, the wash is
Okay,
there.
what time did you eat? Do you know?
It's about 8 o'clock this morning.
Okay, all right.
This is just going to be cold. Can I get another one? Yep. Ready here?
Okay. Okay, so just in summary there again, this gentleman, 33 years old. We've started an MHP for his hemo-pneumo, presumed pelvic fracture, and his shock index greater than 1. We've started the first 2 units. Serena, if you can go ahead and let me know when that's finished for the hemo-pneumo, the chest tube.
Lidocaine, please. Yeah.
And then we'll, as well, we've started his temperature control with the bear hugger there. And we'll get fluid warmed with our level 1 infuser. Any other considerations or other thoughts?
No, I just want to follow up with lab because these first 2 units are going in fast, so
Okay.
I'm going to need some more blood. And is
Great.
there anything else we should think about in terms of products?
The TXA.
Okay,
Yeah.
TXA, has that gone in yet, Jess?
Not yet.
Anything else we need here, Serena?
I think we're good for now, thanks.
Okay, perfect.
Just from lab, I have your next factor MHP.
Perfect. Do you want to just put it up here, actually?
So you have 4 units of packed cells. And
Awesome.
Just gonna reach over you. The TXA is running in
Okay.
now.
TXA is running, thanks, Jess. And you're running 1 or 2 grams, Jess? Okay, great. Yeah, please give 2. Okay, when Serena's finished there, we're just gonna recap so everyone's on the same page.
After that, can we shed blood?
Okay, the chest tube is in. We got a little bit of blood come out and a nice whoosh of air there.
Okay, this is critical, everyone. I'm just gonna take this phone call. Hi, it's Gregg Bolton.
Hi, this is Dr. Jesse Guscott calling from St. Mike's. I'm the TTL today. I heard you have a case.
Oh yeah, great. Thanks for calling. I have a gentleman here I'm concerned that needs to transfer. He's a 33-year-old gentleman who is hemodynamically unwell after an ATV rollover. Based upon his shock index and a positive FAST, I've initiated an MHP. I don't have much of a background, but it sounds as if he's a healthy person. I'm concerned that he has a pelvic fracture as well as a positive FAST, and he has a positive, we decompressed his chest for a pneumothorax.
Okay. Head is okay. Airway is okay so far.
Yeah, he is GCS 15. He's got some bruising to his head, but I haven't had a chance to do any imaging outside of just some portable x-rays, but he's talking to us and his GCS is 15.
So it sounds like your primary concern is hemodynamics right now.
Yeah, absolutely. I'm concerned that he's quite unstable.
Okay. Can you just tell me a little bit about your massive hemorrhage protocol? So you've given him 2 units of blood so far, and you've got a pack coming. Is there going to be FFP in that pack?
No, on our second pack, we don't have access to FFPs. I can call for platelets, but they're not going to come for the next numbers of hours. So I think my plan was to give him fibrinogen as well as PCC.
Okay, that sounds super reasonable. And how much blood do you have in your hospital? Will you have more blood after that pack?
I think I have to double check with my lab, but we might run out after our second pack.
Okay. All right, sounds good. Let me get working on trying to get a helicopter for you, so we will accept at St. Mike's, and we'll figure out what we're going to do in terms of more blood product, depending on arrival.
Okay, great. Thanks.
Okay.
Okay, bye. Okay, so he's been accepted at St. Mike's, and they're going to check weather for Orange to come and pick him up. Any other thoughts or suggestions?
He's GCS 15 right now, but do you want me to have some airway equipment at the bedside just to be ready?
I think that would be a good idea.
We are going to proceed with the fibrinogen despite not having the level.
Yeah, we don't have the level, so I think based upon how sick he is and the multiple injuries, I think we go ahead with the fibrinogen.
Okay.
And then do we have PCC in that second unit?
Yeah, I've got the Octoplex now, so they're going to check the red cell concentrate and I'll mix these two.
Okay, and the Octoplex is 2,000 units.
Correct,
Yeah. Okay, great. Had a chance to get to a secondary survey. Is there any chance? We've gone through CABC there again. Do you mind doing a secondary survey? Just to,
Yep.
no, why don't you do the airway stuff and then do the secondary survey after? Great, thanks.
So doctor, just so you know, that's the end of all red blood cells in hospital. So if you are
Okay.
sure what your transfer plans are.
Okay. Can you? How quickly could you get more blood?
I can see. I'll make some calls and let you know.
Okay, yeah, please, because I'm unsure when this person is going to be transferred. But if you could let me know if we have more blood. But this is the last of the blood.
This is the last of the blood.
Okay. All right. Thank you.
Sure.
At the bedside with airway equipment in case
Sure.
you do an RSI.
How much of each do you want?
Let's do 300.
Okay.
Are you just getting drugs, Serena?
Yeah, just
Okay.
have it bedside with the equipment.
Okay.
Alright. I'm just going to do that secondary.
Yeah, perfect. That's great. Sorry, I haven't had a chance to get there. Okay, I've just got Critical is calling me back here. I'm just going to see, Serena, you're going to go ahead with that secondary survey there, and you guys are working on the fibrinogen
Give me a
and
tight
the PCC.
squeeze on my hand
okay,
there.
I'm just going to step out and take this phone call
Great.
here.
Okay.
What's running through the access on the left side there, Jess? Just
Nothing now. The TXA is done.
and the TSA should be in. So I'm gonna
Push your
put
foot
the
down.
Octoplex there.
Yeah.
Good.
Yeah, hi,
I
it's
have
Gregg
to
Bolton.
Put down.
drawn up.
Great.
No. Yeah, do you have, is there an ETA on the helicopter? Okay, great. Okay, thanks. That's perfect. Okay. Okay, so that's just, I hear back from Orange and from Critical. So they do have a helicopter en route. Their ETA is about 15, 20 minutes, they said. Okay.
Secondary survey. He's got good pulses, moving all four limbs. No
Okay.
other injuries.
Okay. I think just based on his concerning his chest and his pelvis, I don't want to do a log roll right now. I think we'll just leave that for now. I think we have other things that we need to work and focus on here from a secondary survey standpoint.
Just to update, I've got PCC hanging right now, 2000 IU, and I'm working on the fibrinogen 4 grams.
Okay.
TXA
Great.
is in,
Great.
and we're going on units 3 and 4 of blood.
Okay. Jess, do you have a job right now?
What do you need?
I think just with that second, as we're getting more units in here, I think we should probably give 2 grams of calcium.
Sure.
And let me know when that's through. That would be great. Okay, so just in summary here, just for my own brain. So this is Rhett. He's a multi-system trauma who we've activated MHP based upon his shock index and his positive FAST and presumed pelvic fracture. He's had, and we're working on numbers of units of pack cells. How many cells has he had? How many pack cells has he had?
This will be 4 total.
Okay, great. We're working on our fibrinogen and as well as our PCC.
PCC's in.
Great. And he's had his TXA. And we don't have levels, so we're going to go ahead with that fibrinogen like we talked about. We've done a secondary survey and we don't see
We
anything
did get
there.
confirmation of the pelvic.
Keep going based upon his his blood pressure. I'm concerned that we still need to continue on giving him and transfusing him units.